Okay, because we want to have as much time with Dr. Spinazzi as possible, I think we'll get started and people can join us as we go along. So hello, everybody. This is Susan Henderson from Disability Rights, Education and Defense Fund. And thank you for joining us this evening for COVID-19 vaccines for disabled children with Dr. Spinazzi. This is brought to you by the California Parent Training Information Centers, DREDF, in Berkeley, California, Matrix up in the Marin County area, Exceptional Parents Unlimited in the Central Valley, located in Fresno, Parents Helping Parents in Santa Clara, serving the Silicon Valley area, Support for Families of Children with Disabilities in San Francisco, Task, who serves most of all of Southern California, and also by the California Foundation for Independent Living Centers. So thanks for joining us. And now I want to hand it over to my colleague, Cheryl Thies, who is going to go ahead and introduce Dr. Spinazzi.
Good evening, everyone. Thank you so much for joining us tonight. We're really excited whenever Dr. Spinazzi agrees to do things with us. Not only is she a primary care physician at Children's Hospital, UCSF Benioff Children's Hospital in Oakland, and has a special interest in children with complex care needs and developmental disabilities, but she is a physician who understands something that I think all of us who have children with disabilities understand, which is that the distinction between healthcare and education is not always a very realistic one. So Dr. Spinazzi, in addition to everything else she does, has been known to show up at IEP meetings, is a tireless advocate for her patients and their families, and making sure that the right to education and the foundational assumption that every child can learn given the right support has just made her such a tremendous ally, and we're so pleased to have her here tonight.
So Dr. Spinazzi, you want to go ahead and share your screen, or did you want me to share mine?
I would love to share my screen.
Okay,
and what I am going to just say is that I am putting in the chat 2 links, and I will do them at the end of the presentation as well. And the first one is a survey in English, and the second is a survey in Spanish, because I would really like your feedback. Even though I do presentations like these a lot, I'm always learning how to do it better, and I would love your feedback. So at any point during the presentation, please click on the first link is in English, the second link is in Spanish, to give me some feedback. Thank you for letting me request people's thoughts. They're very important to me. And now let me share my screen. Here we go, share, and then view slideshow. Okay, can everybody see my presentation?
Yes, we can see.
Thank you. Okay, so thank you everybody for having me tonight. My name is Noemi Spinazzi, and I am a primary care doctor at Children's Hospital Oakland. I have been doing a lot of work around how we stay healthy and safe in the time of the COVID-19 pandemic. And as Cheryl and Susan mentioned, I work closely and largely with kids with developmental disabilities. So this is my area of expertise. I always like to start any presentations by sharing what my values are. I want you to know that I strongly value transparency. That means that I am going to be completely honest with you tonight, as I am always. And that means that I'll tell you what I know that is scientifically accurate. And I will also tell you if I don't know something or if I don't know something yet. I believe in safety, and I believe in that safety is achieved when we all take care of each other. And so, as I will show you in my next slide, I think that we have shared goals around keeping each other safe and each other's families safe. And that is a guiding principle in the work that I do. I believe in equity. And here it says racial equity, but I also believe in equity around abilities and equity around gender and sexuality and equity in general. And my work always aims to lift up those who are struggling disproportionately with systems that have entrenched inequities. I believe in collaboration, and I believe in empowering each other by working together. This is why I lean on you as families and educators, and we can lean on each other to work together to better understand how to keep each other safe and healthy. And I believe in recovery and resilience. This pandemic has been so hard on all of us in different ways. Those of us who have had to work on the front lines as educators and healthcare providers, those of us who have been home with our kids for a year and a half without any school, um, those of us who have lost someone or know someone who's lost someone because of COVID-19. And I believe that together we can recover and that we are strong and resilient and we can overcome this through keeping each other safe and high quality information. I also think that we have shared goals. I think that all of us want to keep our families safe and healthy. I think that many of us, if not all, want to protect each other as a community. I also think that many, if not all of us, want to protect our children from harm. I just want to make sure we know that these are really shared goals that I have also. Because when we understand that we share the same goals, then it's easier to trust each other. And I want you to know that I am on a mission to fight misinformation because, as Dr. Marcela Nunez Smith said, and I quote her, "What keeps me up at night is misinformation and disinformation and how fast it's moving." I try to keep up, but social media, the internet, beat me to it with so much incorrect information about COVID-19, about the vaccine. And that's why I'm here tonight to share with you high quality information in hope that as a new normal, we restore trust in science, evidence, and data. With that, I want to remind us that when we're talking about COVID, and I know that this is a talk about the vaccine, but when we talk about COVID, we're talking about layers of protections and that there are many layers that can protect us. And each of those layers has holes, just like a slice of Swiss cheese has holes. But if we pile up layer upon layer, then we can plug up those holes and fortify our protection against COVID. So I'll talk to you about getting vaccinated, but let's review some other important layers of protection. One is wearing a mask. Masks really work to decrease the spread of COVID-19. We want to wear our mask all the time, except when eating or drinking. And we want to wear it correctly over our nose and mouth. I told you I mostly work with kids with developmental differences. And so I know that for many, wearing a mask has been a difficult lesson to learn. What I've also seen over the past 2 years is children who started out completely unwilling or unable to wear a mask and moving to being super good at wearing a mask a lot of the time, if not all of the time. So I really do think that this is something that we can support our children with developmental differences in learning. Maybe we need a different brand, a different shape. Maybe we need some gradual desensitization to the mask. Sometimes we need some behavioral incentives to wear the mask or breaks. But for all of those who can work on this, it is still important to work on it. And for those who cannot tolerate a mask, let's emphasize other layers of protection. Also, we are protecting each other, shared value. If I just ate or took a drink from my drink and I forgot my mask down, or maybe my mask slid below my nose, help me, please remind me to put it back up. We're all in this together. Please let's remind each other to wear our mask and wear it correctly. Stay home if sick. I know that it's hard because kids get sick all the time. And in children, COVID-19 can really look like a regular old cold. So how do we know if this is allergies or just a cold or COVID? The only way to know is through a test. That is why if you're sick, you should get tested. Runny nose, fever, cough, upset stomach, headache, loss of taste or smell is less common in children. Diarrhea, really any symptom of illness, when in doubt, get tested. Also, of course, if you're waiting for the result of a COVID test, you should stay home unless it was before a surgery as a routine test. If anybody at home has COVID, you're supposed to stay home. And if someone told you stay home, you're in quarantine, you're supposed to stay home, right? Now, some of our children, maybe with Down syndrome and flat nasal bridges or other chronic conditions, they may have some chronic symptoms, maybe some chronic congestion that's kind of the same all the time. If you've been tested and you're negative and your symptom is the same, you can work with your doctor to clarify with your school or childcare that that is a chronic symptom and you can still attend school. However, if the chronic congestion turns into more of congestion, more runny nose, a new cough, that should prompt staying home and a test before returning to school. As I mentioned, when should I get tested? When in doubt, just do it. There are a couple of different tests. They both involve a swab up our nose, which is not comfortable, and I know it can be difficult for many of our children. One is called the PCR. It's more accurate, but it takes a little bit longer for the results to come back. The second one is a rapid test. It's slightly less accurate, although it's actually still quite good. And the nice thing about it is that there are quick results available, typically within 15 minutes. So which test should I use? Sometimes the school or childcare will tell you exactly which test to use. If you have a choice, then whichever test is easier to access is the test that you should use. Hand hygiene is important. Hand hygiene often, including after touching what are called high touch surfaces. So things like light switches, doorknobs. Your phone is so dirty. Then lots of hand hygiene helps. Hand sanitizer or soap doesn't matter as much, but frequent hand hygiene. We do say use soap and water before and after eating and after using the bathroom. Disinfection of all of the surfaces is less helpful because it's not worth the effort. You're going to go and disinfect that one little corner and it took so much effort, and then someone touches it and you have to start from scratch. It is much more bang for your buck to just disinfect your hands often, especially before touching our eyes, nose, or mouth. Ventilation and filtration have to do with air exchange and cleaning. Ventilation is exchanging air. We can do that with opening windows. We can do that with fans that blow out of a room. This can help clear out virus particles. Air purifiers and other filters can disinfect the air, and they have been installed in many classrooms and are available. They're called HEPA filters, for example, and are available for purchase as well. This is something that is independent of what your child can and cannot do, and so it's one layer that is available to all. If you want to gather if possible, choose to gather outdoors. The breeze will carry away viral particles and will make it less likely if someone is infected for contagion to happen. Okay, that was all my big introduction before talking about vaccines because I did not want to forget the other layers of protection. How do vaccines work? A vaccine is like a school lesson for the body's defense system. What it does is it teaches the body to recognize a germ, a virus, or a bacteria before we ever come in contact with it in real life. Just like if I tell you, think of Denzel Washington. Most of you will have thought of Denzel Washington's face. Now, most of us have not met him, right? But we know what he looks like. So if we ran into him in the street, we'd be like, oh my God, Denzel Washington. That's what a vaccine does. It teaches the body to recognize a germ before your body ever sees it, so that if your body comes in contact with it, it can say, oh, COVID-19, I know you, and then I'm going to kill you. Make sense? So the COVID-19 vaccine specifically teaches the body to recognize one important piece of the body that sticks out. It's called the spike protein, so that the body can learn to recognize it. Okay. And just like any lesson, it takes our immune system a little time to learn that lesson. That's why we consider someone fully immune 2 weeks after the second dose. As far as what vaccines are available in the United States, we have 3 that are available in the United States. There are more that are available elsewhere in the world, but in the United States, we have 3 approved: Pfizer, Moderna, and Johnson & Johnson. Pfizer and Moderna are very similar. They need 2 doses. For Pfizer, they have to be 3 weeks apart. For Moderna, they have to be 4 weeks apart. Now, if you get your second dose a little bit after those 3 weeks, a little bit after those 4 weeks, that's okay. If there was not an appointment right at 3 weeks, that's okay. It still works. It just cannot be any sooner than 3 weeks for Pfizer, 4 weeks for Moderna. Both Pfizer and Moderna need a booster 6 months after your second dose. And this is a newer recommendation. If you are over 18, some of us who have kids who are teenagers, who are 6 months from their vaccine, really would like to get our kids boosters, but right now it's not approved for kids 12 to 18. It's only for kids over 18 that the booster is approved. Pfizer is approved for children 5 years and older. Moderna is only approved for people 18 and older. They both work similarly. They use something called messenger RNA to teach the body to make that spike protein, so our body can learn to recognize the spike protein and recognize COVID-19 virus. Johnson & Johnson is a little bit different. It uses a courier to bring that little instruction for the spike protein. It's called the viral vector. It's marketed as a 1-dose vaccine for now, although what we know is that it's much more effective if one gets a booster at least 2 months after the initial dose. It is only approved for people 18 years and older. So we have vaccines approved for kids 5 and older. What about the younger kids? Well, we are anticipating that in the first half of 2022, we will have a vaccine for kids 2 to 5 years of age. And then later in 2022, we will hopefully have a vaccine for kids as old as my baby, who are 6 months to 2 years of age. That time cannot come any sooner. I have a master plan of dressing up my baby as a 5-year-old so that I can get her vaccinated now. I'm joking. I'm not going to do that. But I really am looking forward to being able to vaccinate my baby once the vaccine is approved. Why is it taking a little bit longer? It's because the dose for kids 5 to 11 is actually smaller than the adult dose. And for kids in these younger age groups are studying a dose that's even smaller because the kids are smaller. So, and also their immune systems are different. So that's why it's taking so long. Let me tell you a little bit more of why it takes a while for the vaccine to become available. It's because what has to happen before a vaccine is available to us, people in the community, is big clinical trials. What they do in clinical trials is they look for volunteers to be a part of these trials, okay? And what they do is they divide up the volunteers and they give some volunteers the vaccine and some volunteers saline, and they don't tell them what they're getting, right? And then they follow these groups over time and they look for side effects. And then they also look for whether the vaccine works, right? Is the group that's getting the real vaccine getting less sick than the group that got saline? These are called clinical trials. So for the adults, the clinical trials included 30 to 40,000 people because there are many more adult volunteers. Also because they were the early trials and we needed a lot more people in the early trials. There were thousands of kids in the teenage trials. And for the 5 to 11-year-old group, it started out with 2,268 children, and then they added an additional 2,379 participants to expand it for safety, okay? What they saw in those clinical trials that were needed before it could become available to us in the community is that they did not see any serious adverse events, any serious side effects, no serious side effects. And they found that the vaccine works very well in children at this lower dose, that is 1/3 of the adult dose. So because it was shown to be safe and effective, it became available to children, which is why we've had the vaccine for 5 to 11-year-olds for the past month and some change. Now, let me tell you a little bit more about the vaccine in general, okay? First, how can we be sure that this vaccine is really safe for our children and families? Well, as I mentioned, the vaccine is heavily tested for safety prior to becoming available in the community. Those are the scientific trials. Once that's done, the vaccine is no longer experimental. Then it becomes proven to be safe and effective. The trials are over, the scientific trials are over, the vaccine is proven to be safe and effective, and then it's available to the community. Before they make that decision, there's many groups that meet, that review all the data, and also decide, are we all in agreement that this is safe and effective? There are many layers of safety before it becomes available to children. And then after the vaccine is available in the community, there is ongoing monitoring of its safety and effectiveness. What we have seen is that the vaccine is equally safe in adults, children, and teenagers. That many people will feel mild side effects, if any, and they're typically after the second dose. And that what would be considered serious side effects are very, very rare. One of my values is transparency. So let's talk about what those side effects are. The common ones, the ones one is likely to experience, are a sore arm, swollen glands, fever, chills, fatigue, muscle aches, headaches, nausea. These are common. They can happen in about 30% of people who get the vaccine. They're more common after the second dose. Not everybody gets the same. So my husband got his booster last week. He complained of a sore arm. My mom also got her booster last week. She complained of the swollen lymph node. I got my booster a couple of months ago because I'm a healthcare provider. I felt fatigued and had fevers. My friend who got her booster at the same time as me had nothing at all. So everybody's a little bit different, but all of these are just ways that our immune system is responding to the vaccine. They can last 1, 2, maybe 3 days, and then they go away on their own. Sometimes we take some Tylenol or some other medicine to make us feel more comfortable. These side effects are mild and they can happen with many other vaccines also. What we always concern ourselves with in clinical trials is can we expect any severe side effects, and how common are they? Because all medicines and all vaccines can have serious side effects. What we know about the COVID-19 vaccine is that there are 2 severe side effects that can occur, and they're both incredibly rare. One is myocarditis. That's a temporary inflammation of the heart muscle. It's very uncommon. In individuals who are teenagers and adults, it's been documented as 2 to 3 cases for every 100,000 doses given. And it's more common in males between 16 and 29 years of age. What we know, by the way, about myocarditis is that so far, since the vaccine has been approved in kids 5 to 11, almost 5 million doses of the vaccine have been given for the first shot, and 1.2 million kids have already received both doses. And we've seen no myocarditis, either in the clinical trials or in the post-marketing safety data in kids 5 to 11. So this inflammation of the heart muscle seems to be more of a teenage and young adult thing than younger kids. It's possible, in fact likely, that we will see a few cases of myocarditis in the younger kids too. It just seems even more rare. But Noemi, you're scaring me. Myocarditis, inflammation of the heart muscle, like that sounds scary. Yes, and COVID-19 also causes myocarditis. And it's more serious when it's caused by the infection. And it happens more often than it does with the vaccine. So we're not comparing vaccine to nothing. We're comparing vaccine to getting infected, which can happen and has happened and will continue to happen until we come out of this pandemic. And so in the balance, the vaccine is much more safe than the infection. How would one know that they need to be evaluated for myocarditis? Well, if 1 to 4 days after getting the COVID-19 vaccine, someone develops severe chest pain, difficulty breathing, severe fatigue, an abnormal heartbeat, then they should see their doctor. An electrocardiogram or EKG can be a good starting point for evaluating for myocarditis. The other serious side effect that has been seen after the vaccine is an allergic reaction or anaphylaxis to the vaccine. This is also quite rare, 3 to 11 cases for every million vaccine doses given. Even though it's so rare, this is why everybody remains under observation for at least 15 minutes after receiving the vaccine. It's because in the studies, we have seen that if someone has an allergic reaction, it typically happens within the first 15 minutes. And so if you're under observation, you can get treatment for an allergic reaction and then recover. Both of these serious side effects have treatments. Both of these serious side effects do not appear to have chronic long-term conditions associated with them. And both of them are very, very rare, much more rare. It's much less likely for your kid to have this than for your kid to get COVID by living life. Some questions I get often. I wanna just tell you the questions that I hear and then answer them. Well, but my kid is healthy. Why should I get my kid vaccinated if they're healthy? Well, here's my answer. So far, during this pandemic, over 5 million children have been infected with COVID-19. It has caused almost 20,000 hospitalizations and 4,600 cases of a disease called MISC. This is a very serious illness that causes whole body inflammation, including inflammation of the heart, that causes children to need intensive care unit. Is very serious. Of note, 62% of cases of MISC have been in children who are identified as Black or Hispanic. So even though many kids with COVID seem to just have a cold, there is a good percentage of kids who do get sick. And there is this risk, if you get COVID, of getting MISC, which is a really, really serious condition. Also, the pandemic continues to take a toll on many facets of our children's lives, including their mental and emotional health, their social well-being, their development, their educational experience, which is particularly important for our children with developmental differences who rely on school for receiving their developmental therapies. Kids who are served 0 to 3 from the regional center are still getting their therapies through Zoom and through video in many cases, because the pandemic is preventing in-person therapies. And this continues to take a toll on our kids. Also, 1/3 of teenagers who get COVID that's serious enough to get hospitalized are so sick that they need to be in the intensive care unit. So yeah, COVID can be milder in kids, but some kids get quite sick. 5% of those kids, of those teenagers who end up in the ICU, end up on the ventilator. That's really serious. This is the other sombering statistic. 1/3 of pediatric COVID-19 deaths were in previously healthy children without any prior medical conditions. So it is important to vaccinate our children, even if they're healthy. Now I'll flip it around. But my kid has pre-existing medical conditions. Is it safe to get vaccinated? Yes, the vaccine is safe in children with pre-existing conditions. In clinical trials, they work hard to include children who have different medical conditions. And then once the vaccine is widely available to kids and patients, then of course we include kids with pre-existing medical conditions as well. So if your kid has asthma, allergies, a congenital heart disease, precocious puberty, cancer, seizures, neurologic issues, any diabetes, all of these are okay to get the vaccine. In fact, important to get the vaccine, because even though it's important to get the vaccine if you're healthy, in my opinion, you're more likely, well, we know from the data that you are more likely to have a more serious illness if you have pre-existing conditions. So ever more important to get it. The vaccine is safe for children with developmental disabilities, including autism, Down syndrome. We in our clinic have been running a COVID-19 vaccine clinic since the vaccine has become available. And so many of my patients with developmental differences have now gotten vaccinated, and they have done so well. And so many of them send me pictures, like my friend here, proudly showing that they got their shot and celebrating that they finally had a chance to get protected. We know, and this is well published, that COVID-19 is more dangerous for individuals with developmental disabilities. We don't fully understand why. So this is why it's ever more important to consider vaccination for children with developmental differences. Now, one thing that I hear a lot is, but the vaccine, why can't I go natural? Why can't I just go with natural immunity? So first of all, let me change the language a little bit. It's not natural, it's infection-induced immunity. And what we are comparing is vaccine-induced immunity to infection-induced immunity. So let's compare them. Vaccine-induced immunity is 5 times more effective at preventing COVID-19 infection than infection-induced immunity. In fact, someone who's had COVID already is 5 times more likely to get it again than someone who's been vaccinated. The vaccine-induced immunity lasts longer. Here's the other kicker. If you get sick with COVID, 1 in 3 people will not develop any immunity at all. So It's a gamble. I got sick. Do I have immunity now? Yes, no, hard to know. Why is that? We think it's because the body is so busy surviving and fighting off the infection that it does not have the energy to also create immunity. So the infection-induced immunity is less predictable than the vaccine-induced immunity. Now, vaccinated people are 8 times more protected from hospitalization from COVID and 11 times more protected against death from COVID. What we know from the past several months with that big wave of COVID that we've had in the summer is that 95% of people who were in the hospital were people who had not been vaccinated. What we also know is that 99% of people who died in the past few months were unvaccinated. About 100,000 people, 100,000 Americans have died in the past few months from COVID. That means that 99,000 people who died could have been with us had they gotten the vaccine. That is so serious. So I'm not going to take a chance with infection-induced immunity, and I'm going to go for the much safer vaccine-induced immunity that is more effective and more predictable and more reliable. One concern that many people have is, well, what is in this vaccine? I'm hearing a lot of stuff. What is in this vaccine? Well, it turns out that the recipe for the COVID-19 vaccine is actually quite simple. It's that mRNA, that piece that teaches the body to make the spike protein, to teach the body how to recognize COVID. Some fats that keep that mRNA molecule stable. Some sugars which help preserve the vaccine and the molecule in the vial. And some salts that make it so that when the vaccine is injected, it is at the right acidity to be able to be received appropriately by the body, because the body likes to stay at a specific acidity level. That's it. No heavy metals, no microchips, definitely no microchips or magnets. The microchip thing comes up a lot, so I want to take a moment to say microchips are very big items. If you've ever taken a puppy to get microchipped or a kitty to get microchipped, you'll remember that the needle has to be very big because a microchip is a big size. So if you don't believe me telling you that there's no microchip in the vaccine, believe the size of the needle. The size of the needle they use for the COVID-19 vaccine is the teeniest, tiniest needle I've ever received in my arm. So much that I didn't feel it go in the first time. I was so nervous. I was like, please just tell me when it's done. And they were like, yeah, you're done. And I didn't feel it go in. So there's no physical way that there could be a microchip in the vaccine. One thing I hear a lot is mRNA sounds a lot like DNA. Could that mRNA change my DNA, change my genetic material, and change me forever? Yes, it's a good question, but the answer is no, and here's why. It actually goes in a very specific order. It's DNA, then mRNA, then it makes the protein. It can't go backwards. Like biologically, physically in the body, it does not go backwards. So no, mRNA cannot go backwards and change DNA. Also, mRNA lasts very little in the body, maybe a day, maybe less. So it couldn't have time to make, to change your DNA, even if it could, because it gets destroyed so fast. This one is one I get a lot. Noemi, but these vaccines were created so fast. How can we be sure that they're safe? That's actually a misconception. And here's why. Remember SARS? I hope many of you are young enough that we don't remember SARS, but in 2003, there was a big SARS outbreak, especially in Asia. And SARS was a respiratory virus that was very serious and was causing a very serious type of pneumonia. And around that time, scientists around the world said, oh man, we are in trouble here. we need to be ready, because another coronavirus is going to come around that's going to be more contagious than SARS. And if we don't have a way to make a vaccine, we are in trouble. So scientists like Kismekia Corbett and Özlem Tureci have been working on this type of vaccine this whole career. Okay. And this type of vaccine, these mRNA vaccine technologies, have been studied for over 20 years. So we were simply lucky to have all of this work preceding the pandemic, so that when COVID hit, we had the technology ready to hit the ground running. I got vaccinated in December 2020, and I was pregnant. And there weren't many people who were pregnant who had received the vaccine ever. And so I was worried, and I went back and I read all of these studies from 20 years to really feel good about getting vaccinated. So I'm not just telling you this because I've heard it through the grapevine. I've read these studies. This is the background work that made me feel safe about the vaccine. Some other frequently asked questions. And then I want to make sure I stop and answer your questions that are probably more specific to children with developmental differences. What about long-term side effects? That's a big question and a reasonable question. It turns out that when it comes to vaccines, any side effect that's considered long-term appears within 2 months of the vaccine. That's why clinical trials have to last for at least 2 months after the vaccine to monitor for safety. Because there has been no long-term safety signal, that's why, as a scientific community, there isn't a concern for long-term side effects. We don't have crystal balls and we're not God. However, knowing what we know about vaccine science, this is why there isn't a concern about long-term side effects. Some families tell me, Noemi, I don't do the flu vaccine. We don't really do this kind of stuff. Why should I get this one? My answer is, well, COVID-19 has changed the world, upended life as we know it. It's a very deadly virus. Getting vaccinated against COVID will prevent many infections, long-term symptoms, most hospitalizations and death from COVID. It seems like good reasons to get vaccinated. But I heard that even if you get vaccinated, you can still get COVID. That's true. If you are vaccinated, you can still get infected with COVID. However, if exposed, a vaccinated person is 8 times less likely to develop COVID than someone who's not vaccinated. So it still prevents a whole bunch of infections. And as I mentioned many times, it prevents nearly all hospitalizations and deaths. So there's still a lot of value in getting vaccinated, even if you could still get COVID. So if you want my advice for yourself, for your children, get protected. We are all in this together, and the vaccine is a huge tool that we have. And thinking about those layers and thinking about how it can be hard for many kids to tolerate the mask and tolerate it long term, how there may be more hand-to-mouth behavior for some of our kids with developmental differences and forgetting to wash our hands, how kids like to get close to each other and all that. Some of those layers that we talked about at the beginning kind of break down. And so layers like the vaccine, much like a layer like ventilations that are independent of a child's developmental level and behavior, are a huge asset that can really protect our children. Before I turn to questions, I would be remiss if I didn't talk about Omicron because it's been in the news a lot. So just 1 minute to explain that when a virus is in our bodies, it makes more copies of itself. And when it makes mistakes, those are called mutations. And when enough mutations accumulate, the virus becomes slightly different enough to be called a variant. So we had the Delta variant that was more contagious, and that's what caused that big spike in the summer. Now Omicron in the news is concerning because it has a lot of mutations. It's more contagious. It's 2 times more contagious than Delta, which was already more contagious than the original COVID. It appears that it is good at reinfecting people who have already had COVID. That's what they are seeing in South Africa, which is the epicenter. They are seeing more breakthrough infections in people who are vaccinated, and the booster does seem to protect against Omicron. So if you are recently vaccinated with 2 doses, you should be okay. And then if your booster, if you haven't been, if it's been more than 6 months since your second dose, go get your booster, because that really seems to protect against Omicron. We don't know yet how much immune evasion there will be, or how much more severe disease it causes. So we're not out of the woods yet. We need to continue to use those layers of defense. And again, you know, though it may be more contagious and may be causing more breakthrough infections, so far of the infections of Omicron we have seen in vaccinated people, they have presented as mild symptoms. So it seems like the vaccine continues to protect against severe disease even with Omicron, which is really good news. So with that, I want to stop and take questions and really make sure that I'm addressing the concerns that this community has.
So, Noemi, this is Susan. Thank you so much for that. Let's see, I think you may have answered this. There was, out of all children 5 to 18 years given the COVID vaccines, how many serious side effects have been reported in the US? And I think you answered that because there hasn't been any, right?
Yep. Isn't that amazing?
That is amazing. Is there any special risk for autistic children?
Sorry. And what I want to say is what has happened so far is what has happened so far. If I had to make a prediction, I think that we will see some allergic reactions. We may see some myocarditis. I'm a realistic person. And by doing the math, if in young adults and adults, we're seeing 2 to 3 cases for every 100,000 people vaccinated of myocarditis, and we have vaccinated 1.2 million children with 2 doses, by now, we should have seen about 30 cases of myocarditis. So the fact that we have seen 0 is very reassuring. It means that even if we see some in the coming days and weeks and months, it seems a lot less likely and less rare. As I told you, I'm transparent. So I don't want people to walk out of here saying, impossible, it won't happen, and then it happens, and then people will be like, why should I ever trust that person again? It hasn't happened yet, and that's a good sign, because enough doses have been given that we should have seen it, and we're still watching.
Thanks for making sure that's clear. Is there any special risk for autistic children to get the vaccine?
So my answer is no. And then my longer answer is we have to recognize that studies that are done in children volunteers do try to include children with developmental differences, including people with autism, and it's a smaller percentage. What we do have a large body of literature on is vaccines in kids with autism in general, and we know that they are safe, and this vaccine is no different. We also have many adults and young adults with autism who've been vaccinated until now, and they've done completely well without any difference from neurotypical people who have been vaccinated. So I have 0 reason to believe that children with autism will react any differently to the vaccine. Now, we know that getting a vaccine for a child with autism can be a difficult experience. And so preparing someone with a social story about going to the doctor and getting a shot, creating an expectation that there will be something fun that happens afterwards, making sure that the child has some way of communicating if their head hurts, or whether it's through sign or picture communication, so that we can give them medicine. How can they tell us that they feel sick? These are all things that we can think about as special considerations in regards to the shot for someone with autism. But as far as the biology and side effects, I don't expect any difference.
Right. Actually, that links to another question that was asked about if there are there low trauma protocols for unwilling individuals with developmental disabilities.
What I have seen is that, for example, there's a parent I love and work with. I'm lucky to take care of her daughter, and she took it upon herself to create a vaccine event that was sensory friendly and was thoughtful of the needs of people with developmental differences who fear vaccines. On a large, and then I've seen some of these events done in the community and marketed as uh, friendly to people with developmental differences. On a large scale, as far as hospital systems, I've not seen as much of this. I want to recognize that hospital systems are exhausted and overworked, and that doesn't take away the responsibility to create sensory friendly and low impact opportunities, but also just recognizing the huge overhaul that is trying to vaccinate the millions of children in our area and having not as much bandwidth to create those kinds of programs, even though we need them.
Okay, thanks. And what are your thoughts about seizures in the vaccine and metabolic disorders and the vaccine?
Yeah, the same as every other vaccine. So I have some of my patients who have epilepsy, and I take care of a lot of kids with epilepsy who, when they are sick or they have a fever, then they may have some breakthrough seizures. And so I think of it just like that, as you get the vaccine, you are going to watch out for the same things that you watch out for after any other vaccine. I am heavily recommending the vaccine in my patients who are medically complex and have seizure disorders. And then you mentioned another metabolic disorders. Same. When I think of metabolic disorders, I think that the main issues are low blood sugar, dehydration, and these are the things that we watch out for in kids with metabolic conditions. So if a child has a metabolic disease, you just want to refer to your sick plan, so that if someone after the vaccine is feeling a little achy and not feeling like eating or drinking as much, you can put your sick plan into action. But as far as the safety of getting the vaccine or expecting any difference in side effects, I wouldn't expect anything different.
Okay, thanks. So there's a couple of specific questions that are specific to certain medications or allergies. My son is allergic to cephalexin, tree nuts, and milk. Should I be concerned about an allergic reaction to the vaccine?
Not really. The allergic reactions to the vaccine, as I mentioned, they're really rare, 3 to 11 cases for every million dose of vaccines given. And you just want to make sure you're observed. You can stick around for longer than your prescribed 15 minutes if you're worried. You can bring your EpiPen on you if you're really, really worried. But frankly, again, we run a vaccination clinic upstairs at our clinic, and we are vaccinating kids with all kinds of pre-existing allergies. And it's so rare. It's so rare to have an allergic reaction. Not impossible. So stay monitored and bring your stuff and do it in a healthcare setting. Especially if you have known allergies and you want to be safe, do it in a healthcare setting. Maybe don't do it at one of those vaccination events, so that you know that there's going to be an EpiPen on site.
And do you know, is there research that shows the efficacy of the vaccines for people with CP, congenital heart disease, ADHD, autism? Is it any different for people with those kinds of chronic illnesses and conditions?
So that type of research hopefully will come. What it takes to do research is, first, the vaccine needs to be available. People need to consent to be part of research, or it's done later on retrospectively looking at what happened to people. And then it takes time to collect that data, and it takes time to write it up, and it takes time to publish it. So considering that the vaccine has just become available for children, I think it's going to take quite some time to know if there's any difference in efficacy. Now, what I would say is, we know that people with compromised immune systems who are on medications that are immunosuppressives, whether it's chemotherapy for chronic steroids for rheumatologic diseases or other medications that suppress the immune system, we know that those patients tend to respond less well to any vaccine, including the COVID-19 vaccine. And so if someone is truly immunocompromised, it's actually recommended that they get a third dose, and it's not called a booster, it's truly called a third dose, and it's given a lot sooner than what a booster would be, and it's going to be available, it's available for younger kids as well, as opposed to the booster being for kids over 18 right now. As far as other developmental needs, no, or other medical conditions, no, there's no biological expectation that it would be different. I take care of a lot of kids with Down syndrome, and some people with Down syndrome have weaker responses to vaccines. So I'm really hoping that clinical trials are done to look at the vaccine response in people with Down syndrome selfishly, because those are the people I take care of the most.
Okay, and then here's another one related to a drug. So I'd like to get my son vaccinated, but I'm anxious about the side effect of the medicine, as he has been taking methylphenidate twice a day for about 2 years.
Mm-hmm. So if someone has been on chronic medication and they are doing well on that medication, the vaccine should not impact how that medication is working and should not be bringing out new side effects. Now, as the immune system is learning the lesson, so in those first couple of days after the vaccine, someone might feel more achy, they may not feel good, and sometimes when people don't feel good, they either get kind of turn inwards and are kind of mopey, or they externalize it and they act out a little bit more. But, looking out, a few days after the vaccine, it should be overdone, and then you don't have to worry about it messing up your good thing that you have going with methylphenidate.
And here's a thing that looks kind of related to the immune suppression and boosters. One of my twin grandsons has long COVID after a vaccination breakthrough infection, yet he cannot be seen at the local post-COVID clinic, nor will they give him the booster because he's not 18 or over. Do you have any suggestions?
I don't understand why they wouldn't see him at the what was the reason why they weren't seeing him at the local COVID clinic, long COVID clinic.
They didn't say, but I think the same person might have written in the chat. Yes. My 17-year-old identical twin grandsons might be the same. They were all vaccinated. Although, yeah, it doesn't talk about why. There's nothing about why they wouldn't see them at the COVID clinic. If you want to, I think it's Cynthia, if you want to go ahead and add that to the chat, we can find out. I'm going to go ahead and ask another question while we're waiting. And then, so this you mentioned this during the presentation about precocious puberty. If somebody's under, how may the vaccine affect my daughter if she's under hormones treatment for precocious puberty?
So the treatment for precocious puberty is called Lupron, and it acts on how puberty is the brain talking to our ovaries or testicles to make the puberty hormones, and the Lupron kind of regulates that system so that it stops precocious puberty. The vaccine should not impact that at all. What we do know is that for women who get the vaccine, some women have had some temporary period changes for 1 or 2 months after getting the vaccine. And that's something that is being looked at a little bit further. And again, it's thought that because the immune system is kind of busy learning about COVID, it's kind of taking away some of the focus from the periods, and it's causing some period irregularities. But that is a very different mechanism than how precocious puberty is treated. So I think it's safe for your child who's being treated for precocious puberty to get the vaccine.
Thanks. And then one of the last questions that was submitted ahead of time was, our child had a negative reaction to a vaccine that was required. This is about 2.5 years ago. And since getting that vaccine, our child is not the same. Because of this experience, we are extremely hesitant and concerned with giving the COVID-19 vaccine.
I hear you. I hear you. That is a very difficult thing that you've been through. I don't know what happened to your child, and I don't know what has been done to work up why your child is no longer the same, and I hear your hesitancy. What I can say is that this is a different vaccine because the COVID-19 vaccine wasn't available at that other time. And that this is going to be a family decision. If you are truly certain that it was the vaccine that caused a change in your child, then I imagine this will be a difficult decision for your family. And I hope that you have a good healthcare provider that is helping guide you through this decision. I don't know that without knowing you personally and knowing your child personally, I can tell you, go do it or don't do it, because I would need to know more about the case, but I can definitely hear how agonizing it must be for you to have to make this decision.
Thanks, Noemi. I have a 7-year-old son with mild Cornelia de Lange syndrome. Is my son at a high risk of getting severe COVID? And what might be the side effects for the vaccine with CDLS?
Yeah, so Cornelia de Lange syndrome is a genetic syndrome, and it, like many genetic syndromes, there are some that have more mild presentations and more severe presentations. And I know that Cornelia de Lange can be associated with some growth differences and feeding difficulties sometimes, some developmental differences, sometimes respiratory issues. One child I took care of had a lot of respiratory issues. So is your child at higher risk for COVID-19? Again, it depends on your child's history and profile. So I don't know. If your child has had a history of repeated respiratory infections or other medical complexity, I would say yes. And then what I also showed you is that even healthy children should have a chance to get protected against COVID. So and then as far as different side effects, again, because Cornelia de Lange is a pretty rare syndrome, I strongly doubt that anybody with Cornelia de Lange was included in the original trials, much like they were unlikely to be included in the original trials for any other childhood vaccine, yet we give all childhood vaccines to all kids, even if they have genetic syndromes. So I think that it's worth approaching this vaccine like we do all other vaccines and say, if it's safe and effective for kids, then it's safe and effective for our kid who has something else different about them.
Thanks. There was a question in the chat about what would you say to people who want to get pregnant and are hesitant to get vaccinated?
Get vaccinated. The vaccine does not impact fertility, and COVID-19 in pregnancy is serious, and it is associated with a higher rate of miscarriages and premature births and in utero growth restriction. So if you're not pregnant yet and you're thinking about getting pregnant, great, get protected so that you don't have to worry about getting COVID during pregnancy or severe COVID during pregnancy. I told you about the effects on the fetus, but pregnant women also get much sicker with COVID when they get sick with COVID and are more likely to need ICU and a ventilator. And these are things we see in healthcare, including at the hospital where I round the Delta Bates when the babies are born. So get vaccinated. And if you're pregnant, get vaccinated. I did it, and I'm so glad that I did. And I signed up for a clinical trial to help other pregnant women by, you know, being the quote unquote guinea pig. And the studies have been published in JAMA, and we now know that not only is it safe, that the antibodies are passed to the baby. And by getting vaccinated in pregnancy, I was able to protect my baby, and that I have antibodies in my breast milk that are still protecting my baby. So I've been through it, and I hear you completely. And my advice is to get vaccinated.
Thank you. Shay asked, can you provide the data regarding children with developmental disabilities in COVID-19? I've been unable to find the specific information that the doctor's referring to that addresses additional health risk and illness that presents children with developmental disabilities who contract COVID. And I know that's a lot to do. I mean, you might not have it at your fingertips, but if you send it to me, when I send out email after this, I can include links to some research or reports.
I'm gonna write it in one of my many Post-it notes.
Great. Let's see what else. I saw another questions. For vaccination and depression, any data about that, how vaccination might affect children with depression?
Great question. I don't know that there is data on kids and depression. We don't have, we have many kids who are depressed, especially after this pandemic, but in general, we have seen depression throughout our careers, taking care of kids, and we still give routine childhood vaccines. So again, I wouldn't expect anything different with this one. Great question. I hope that they studied it.
Yeah. A lot of people are asking, a few people have asked where your office is, and one, do you see patients at the Walnut Creek Children's, is it Shadelands? Shadelands.
Yeah. I work in Oakland. I work at Children's Hospital Oakland. I'm a primary care doctor at the Primary Care Clinic associated with Children's Oakland at Claremont Avenue, right by the DMV. That is where I see patients. I have a dream one day that I am at Shadelands and on the West Bay, and that I clone myself and also find the way to expand time so that every day has 48 hours in it so that I can do more stuff. But right now I only see kids at Claremont Avenue in Oakland.
And then Noemi, there's a question in the chat that's in Spanish.
Mm-hmm.
If you can scroll up and see it.
Yes. What are the side effects of the vaccine in children from 5 to 8 years old? Can they have fever like adults? Yes, they can. About 30% of children, 5 to 11 in the studies, had some mild side effect. The most common was headache and fatigue. Less common were the fever and the chills, but yes, it can happen. And so have a thermometer on hand and some Tylenol available in case your child has a fever.
And then do you think people are going to need a booster every time there's a new major variant?
It depends on whether we get people vaccinated in a timely fashion, basically, because viruses will continue to mutate. And unless we create a strong enough barrier, I think that there will come a virus variant that is resistant to the vaccine. And at that point, we will need a different booster that protects against that variant. Right now, the booster that we get now is the same as the first and second dose that we have gotten. It's just making our immune system remember it and strengthen up that protection. But I think that we are looking at the potential of targeted boosters if we continue to see these more and more intense variants. I think that going forward, what it's going to be like is kind of like with the flu vaccine, the flu vaccine is a little bit different every year, because every year we know of what strains were causing a lot of disease in the southern hemisphere during their winter, and then it gets updated so that we can be protected against those major strains during our winter. And so I expect that what it will probably look like is something like that, where the vaccine gets updated, but we are not there yet. Right now, we're still in the thick of it, and the more we delay people around the world having access to the vaccine, and ourselves getting protected, the more likely we are to continue to struggle with variants and the need for potential targeted boosters.
And I know we're at the very end, and there's a request to close with a comment on the cost benefit of the small risk of vaccine side effects versus vaccine mandates, meaning kids can't attend school. So if there's a vaccine mandate and you don't get, I guess that would be.
So hear me out, okay? I think that I hope that by now you have understood what I think, which is that based on all of the data that is available, I believe to my core that the vaccine is safe, that the vaccine is effective, that the vaccine is a chance for us to come out of this terrible pandemic. And I got my 3 doses, as so has everybody else I love, and I can't wait to get my child vaccinated. So to me, what is the vaccine is a benefit, and the risk is to be around unvaccinated people, and there is risk to missing school. Now, people feel differently, right? I am a parent, and I'm making decisions for my child, and I have agency over my body, and I'm making decisions for myself. And so and we live in a society that has experienced institutionalized racism, and mandates often being things that negatively impact specifically underserved communities. So it makes sense that some people are really pissed about mandates, right? And I don't want to minimize that. I'm not here to tell you whether a mandate is right or wrong. I'm here to tell you that the scientific data says that the vaccine is safe and effective, and that we shouldn't be afraid of the vaccine. We should be afraid of COVID. I'm afraid of COVID, and of course, school is vital. School for me is a vital sign. I look at blood pressure, heart rate, oxygen, and how's school going. And anybody who comes to see me as their doctor knows that I treat it like that. So I think that school is essential, and it is going to be hard as mandates are being implemented if someone is really staunchly against the vaccine. I'm just hoping that by having access to high quality information, people feel less scared about the vaccine, and feel more open to thinking about getting their kids vaccinated.
Thank you, Dr. Spinazzi, so much for all this. I'm sorry, we've got to cut off. We're at our time for both our interpreters and our captioners. So thank you so much as usual. Everyone, we will make the recording available as soon as we get it captioned. It'll probably take sometime midweek, and we'll let you know when it's up and about, and you can share it widely. So thank you all so much. Good night, everyone.
Thank you for having me.
Thank you.